Picture this. You're sitting in your doctor's office, you've just been diagnosed with ADHD, and now you're faced with a choice between Adderall and Ritalin as a medication option. Your mind's racing with questions. Which one works faster? Which one lasts longer? And what about side effects? If you're feeling overwhelmed, you're not alone. Today, I'm breaking down the Adderall versus Ritalin debate once and for all. In this episode, we're going to explore how these medications work in your brain. We'll look at how well they treat ADHD and what side effects you might face. My ultimate goal is to give you the info you need to talk to your doctor about what's best for you. And who am I to break this down for you? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And I have these discussions so many times that I might as well just make a recording and push play on my appointments for the next time that it happens. Wait a second. That's not a bad idea. Did you know that despite their similar uses, Adderall and Ritalin work in subtly different ways? The key to choosing between them might lie in understanding their unique personalities in your brain. Both Adderall and Ritalin are stimulants used to treat ADHD, but they're not identical twins. Think of them as cousins with distinct personalities. Adderall contains a mix of amphetamine and dextroamphetamine, while Ritalin's active ingredient is methylphenidate. These differences in chemical makeup lead to some interesting variations in how they affect your brain. Let's talk brain chemistry for a moment. Both medications work by increasing levels of norepinephrine and dopamine in your brain. These neurotransmitters play a crucial role in attention, focus, and mood regulation. It's like they're turning up the volume on your brain's ability to concentrate and filter out distractions. But here's where things get interesting. Ritalin is like that friend who shows up early to the party. It typically has a faster onset of action, with immediate release formulations peaking in your blood within about 2 hours. Adderall, on the other hand, is more of a fashionably later arrival, taking about 3 hours to reach peak levels. Duration is another key difference. Ritalin is more of a sprinter, lasting about 3 to 5 hours for immediate release and 6 to 8 hours for extended release formulations. Adderall is more of a marathon runner, with immediate release versions lasting about 4 to 6 hours and extended release formulations going strong for up to 10 to 14 hours. Now, you may be wondering, okay, Dr. Mirza, but which one works better? Here's the plot twist. They're both pretty effective. Research shows that around 70 to 80% of individuals with ADHD respond positively to stimulant medications, including both Ritalin and Adderall. In fact, Dr. William Dodson, an ADHD expert, puts it this way. One molecule is not intrinsically better or to be preferred over the other. In large groups, they have the same response rate, efficacy, side effects, and cost. It's not about which medication is objectively better, but rather which one works better for you. Now that we've explored how Adderall and Ritalin work, let's talk about something equally important, side effects and other considerations. After all, understanding the potential downsides is crucial when deciding on any medication. Both Adderall and Ritalin share some common side effects. You might experience things like insomnia, loss of appetite, nervousness, headaches, or stomach pain. These effects can vary from person to person, and many find they diminish over time as their body adjusts to the medication. One concern that often comes up is the potential for dependence and addiction. Both medications are classified as Schedule II controlled substances, meaning they have recognized medical uses, but also carry a risk of misuse. This risk may be higher for individuals with a history of substance use disorders. It's important to be open with your doctor about any past struggles with addiction to ensure the safest treatment plan. You might also wonder why Ritalin is often preferred for children and adolescents, while Adderall is favored for adults. It comes down to how long the medications last. Ritalin's shorter duration of action allows for better control of side effects like loss of appetite and insomnia in younger patients. Parents and doctors can more easily adjust dosing schedules around meals and bedtime. Adderall, with its longer-lasting effects, is often a better fit for adults who need symptom management throughout their workday without multiple doses. Long-term use of these medications raises some concerns, particularly for children. There's a potential for growth suppression in kids, which is why doctors closely monitor height and weight during treatment. For adults, there are potential cardiovascular risks to consider, especially for those with pre-existing heart conditions. It's crucial to remember that medication is just one part of ADHD treatment. Behavioral interventions play a vital role, especially for younger children. These might include strategies for organization, time management, and focus that will complement the effects of medication. The combination of medication and behavioral techniques often yields the best results. An interesting aspect of ADHD medications is their prevalence on college campuses. Studies show that up to 38% of college students seek these medications, often for their perceived cognitive enhancement effects. However, it's important to note that these drugs don't actually improve cognitive function in people without ADHD. Research indicates that non-ADHD individuals taking these medications don't perform better on cognitive tests than those taking a placebo. Now, all this talk about side effects and risks might seem alarming, but here's the key takeaway. While side effects exist, serious adverse events are rare. Many people with ADHD find that the benefits of these medications far outweigh the risks when properly managed under a doctor's care. Your experience with either Adderall or Ritalin will be unique to you. Some people find that one medication works better or has fewer side effects than the other. That's why it's so important to work closely with your healthcare provider. Be honest about your symptoms and any side effects, and be patient as you find the right treatment plan. Now that we've explored the science and side effects of Adderall and Ritalin, let's talk about how to make an informed decision. Choosing between these medications isn't a simple task, but with the right approach, you can find the best option for your unique needs. First and foremost, consulting with a healthcare provider is crucial. Your doctor has the expertise to guide you through this decision, taking into account your medical history, lifestyle, and specific ADHD symptoms. They'll also be able to monitor your progress and adjust your treatment as needed. It's important to understand that finding the right medication and dosage may involve a trial and error approach. In my clinical practice, I go by the old mantra of start low and go slow when initiating and increasing the dose of stimulants. This process requires patience and open communication with your healthcare provider. Remember, your personal factors play a significant role in how you'll respond to medication. Your age, daily routine, work or school demands, and specific ADHD symptoms all influence which medication might be most effective for you. For example, if you're a college student with long days of classes and study sessions, a longer-acting medication like Adderall might be more suitable. On the other hand, if you're a parent of a young child with ADHD, the more flexible dosing schedule of Ritalin might be preferable. Cost is another important consideration when choosing between Adderall and Ritalin. Both medications are available in generic forms, which are typically less expensive than brand name versions. However, insurance coverage can vary significantly. Some plans only cover generic versions, while others might prefer one medication over the other. It's worth checking with your insurance provider to understand your coverage options before making a decision. Finding the right medication is a collaborative process. It's not just about your doctor prescribing a pill, it's about working together to find the best solution for your unique situation. This might involve trying different medications, adjusting dosages, or even combining medication with behavioral therapies for optimal results. Throughout this process, keep in mind that your needs may change over time. What works well for you now might need adjustment in the future. I tend to see Ritalin family medications as more weight-based as well, so your dosage may change based on that, while Adderall doses are not as much based on weight. Regular check-ins with your healthcare provider are essential to ensure your treatment remains effective as your life circumstances evolve. So, what's the bottom line on Adderall versus Ritalin? Neither medication is universally better. Each has its own strengths, and the best choice depends on your unique needs. The key is personalized treatment. Work closely with your doctor to find the right fit for you. Remember, treating ADHD is a journey that requires patience and an open mind. Finding the right solution might take time, but it's worth the effort. Don't get discouraged if the first option isn't perfect. It's totally normal to need some adjustments. If you're considering ADHD medication, take what you've learned here and discuss it with your doctor. They can help you weigh the pros and the cons based on your specific situation. Your input is valuable in this process, so don't hesitate to share your thoughts and your concerns. And if you learned something new while watching, make sure to like and subscribe, as well as share with your friends and family. Drop your thoughts in the comments below, and let me know your experiences with these meds if you've tried them. Until next time, be safe and be well.